Hello! Today I'm representing for Team 8 to talk about Project 2 on the Patient Protection and Affordable Care Act. Introduction. In 2010, the United States took the first step toward universal health care coverage with the Patient Protection and Affordable Care Act. The PPACA provides advantages for many who are in need of health care insurance or who are not able to get health insurance due to a pre-existing condition. The goal of PPACA is to provide health coverage to all by offering low-cost private and public insurance plans. Public health, disease prevention, and wellness were integral considerations in its development. Although the PPACA has provided health care to a large population who didn't have access, it has also caused trouble for our nation. With all the turmoil the PPACA has caused, we may wonder if, in the future, we will reach a compromise we are all satisfied with. First, we will touch upon the key provisions. Some key provisions of the PPACA are Americans' need to secure health insurance. Health insurance companies cannot deny coverage to individuals with pre-existing conditions, and Medicaid expansions. The provisions attempt to address the limits of the U.S. healthcare system by helping more people get insurance, stay insured, and stop insurance companies from denying coverage for certain medical conditions. Since the PPACA does not allow insurance companies to deny coverage based on pre-existing health conditions, more patients are able to get insurance and better manage their conditions. The expansion of Medicaid can help to get uninsured adults insured. With the PPACA in states that expanded their Medicaid programs, uninsured adults whose income is or at below 138% of the federal poverty level are now eligible for coverage through the Medicaid program. There are many more provisions that PPACA intends to enact in order to make coverage more accessible, such as the individual mandate that requires most U.S. citizens and legal residents to have health insurance coverage or pay a penalty. Insurance companies needed to gain these consumers in order for their care to be paid for. The mandate could simply gain its purpose by having healthy individuals purchase their insurance rather than waiting until they need it. Many individuals are having trouble even trying to comply with the mandate. Therefore, the PPACA continues to make changes to how health insurance could be purchased. Next, we'll talk about the goals. There are 5 goals for the PPACA. The first is to provide health coverage to many uninsured Americans. The second is to provide affordable, quality, and flexible healthcare coverage. The third goal was to improve healthcare value, quality, and efficiency while reducing wasteful spending and making the healthcare system more accountable to a diverse population. The fourth goal is to strengthen our healthcare. The PPACA wants to reinforce long-term care in primary and preventative health care. The fifth goal is to make strategic investments promoting public health education and also preventive services. The exchange plans are also provided to the insured people to choose a plan according to their needs. Each state has 3 types of insurance policies: federal, state, and partnership. Under the PPACA, the states have control over how they fund health care. States can individually control the health policies or can partner with the federal government to operate exchange plans. Covered California provides state-based exchange plans, for example. There are 4 types of plans available for purchase under the PPACA, which are silver, bronze, gold, and platinum coverage. Programs. The PPACA makes sure that health plans offered in small group and individual markets inside and outside of the health insurance marketplace offer a wide range of services, known as the essential health benefits. The reinsurance program taxes health insurance policies and employer group health plans. This program then uses the proceeds to provide individual market plans with additional subsidies for higher cost enrollees. The risk adjustment program is designed to transfer money among insurers to adjust for the possibility that some carriers may get more or less and a proportionate share of costly enrollees. This program applies to the individual and small group markets and is only one of 3 programs that is permanent. Although This program does not increase the total amount of subsidies flowing to insurers, but rather reallocates money already in the system. The corridor program essentially establishes a range of profits or losses for insurers selling exchange coverage. If an insurer has higher than expected profits, the government will claw back some of the money. Conversely, if an insurer has higher than expected losses, the government will pay the insurer additional subsidies to offset these losses. The risk corridor program, like the reinsurance program, is limited to 3 years. Under the PPACA, Accountable Care Organization, or ACOs, are cost-effective managed care plans connecting healthcare providers and patients. The ACOs will ensure a reduction in the number of medical errors and improve health quality care. The main benefit of ACOs is to provide high quality and to decrease the cost of Medicare. Due to the PPACA, healthcare in the U.S. is undergoing structural changes that will create commotion between providers and patients because the ACOs only apply to Medicare Part A and B. In the future, ACOs will apply to all hospital and small facilities to operate better and provide high-quality care to patients, reducing costs and medical errors. Court cases. The case of the National Federation of Independent Business versus Sibelius started with the state of Florida filing a lawsuit claiming the individual mandate and Medicaid expansion to be unconstitutional. Shortly thereafter, Florida was joined by 25 other states. If someone failed to comply with the individual mandate, a financial penalty or shared responsibility payment was due. The Supreme Court ruled the individual mandate constitutional, noting the shared responsibilities that payments will generate $4 billion per year by 2017. The Medicaid expansion was also deemed constitutional, however in a modified form. Instead of states losing Medicaid funding due to noncompliance, states have the option to either expand or remain as is. More recently, the owners of Hobby Lobby challenged the PPACA because they didn't want to provide their workers with contraceptives. The company wanted to exercise their religious freedom, and the morning after pill was an abortifacient since they may keep a fertilized egg from implanting in the uterine wall. In this case, Hobby Lobby won. Civil Rights Act. Kennedy proposed that the Congress should consider civil rights legislation that would address voting rights, public accommodations, school desegregation, and non-discrimination in federally assisted programs. These laws were enacted to prevent discrimination based on a person's race, sex, religion, age, and national origin, giving Americans a sense of protection and equality. According to nearby healthcare providers, such as physicians are not covered under Title VI of the Civil Rights Act of 1964, so they are not punished for their failure to provide quality care. Title VI prohibited discrimination and helped eliminate segregation for employment and public facilities. Based on the George Washington Law Review, Title VII's purpose is to achieve quality of employment opportunities and remove barriers that have operated in the past to favor an identifiable group of white employees over other employees. In 1983, for Section 8, 1983, if a citizen feels deprived, they can take legal action. For example, the Monroe v. Pape case in 1961. An African-American family brought a case to the federal district court against the city of Chicago for waking them up, searching their home without a warrant, and then interrogating the father for 2 days for a murder case he wasn't even a part of. The officers abused their power, but they were not punished for it. The Act of 1985 prohibited conspiracies by 2 or more individuals to prevent an officer from doing their duties, and also intimidating or threatening a party, witness, or juror from testifying. Conclusion. President Barack Obama stated that the Act affirms the core principle that everyone should have some basic security when it comes to their health. Throughout history, the United States healthcare system has always strived to find the right solutions in order to improve quality, implement efficiency, and reduce health disparities. With the aims of PPACA, the healthcare system continually puts key provisions into action and implements key issues where needed. According to Menzel, Moral considerations of justice and fairness make restraining care to be efficient and cost-worthy matter of obligation, not merely economic benefit. Thank you.